Thank you, AIUS, Dr. Dinesh, for giving me opportunity to share my cases with everybody here. So I will be talking on fundus fluorescent angiography patterns in central serous retinopathy cases. I have no financial interests. Now, coming to just simple definition of central serous chorioretinopathy or central serous retinopathy or CSR, whatever you call. CSR is characterized by accumulation of clear fluid at the posterior pole, causing a well-circumscribed area of retinal detachment. Now, leakage of fluid occurs through a discrete defect in the retinal pigment epithelial layers, and fluid accumulates in the subretinal space. So, fundus fluorescent angiography, as already has been told in detail, or you can call it fluorescent angiography or fluorescent intravenous fluorescent angiography. It is a modality to view the circulation of the retina and the choroid. Now, coming to the different leakage patterns in central serous retinopathy, first we will come to ink blot type of leakage. Ink blot leakage starts as a point leak at the RP level and spreads symmetrically in all the directions in the subretinal space. The other common one is smokestack phenomena. Now, dye enters as a point leak, but instead of spreading in all directions, it ascends to reach the highest point of neurosensory detachment and then expands laterally in umbrella or a mushroom-like pattern. In worst smokestack appearances, it is as a smokestack, but instead of ascending, the dye tends to track down towards the lower limit of the neurosensory detachment. You can also find multiple leaks. Sometimes more than one leak may be seen. They may behave either as an ink blot leak or as a smokestack leak or a combination of the both. Diffuse leak is the next pattern. No definite leakage pattern is seen. Instead, a diffuse area of the leakage is seen. In some cases, you will find no leakage, though CSR is present. So probably this indicates a resolving stage of the CSER where leakage has closed, however the fluid has yet not been absorbed. So pigment epithelial detachment is the next, may be located within the detached area of the retina or it may lie outside of it. So entire area of pigment epithelial detachment shows hyperfluorescence in the early film. This increases in intensity toward the later films. However, the extent remains the same. The size remains the same. So then are RP transmission defects. They are seen in the resolved CSR cases, usually quite extensive. The extent depends on the area of previous neurosensory detachment. RP tracts is the next pattern. Now transmission, there are also transmission defects seen in the form of a tract extending downwards from the posterior pole and expanding inferiorly. Now coming to few of my cases, this is my first case, a 46-year-old male presented with defective vision in left eye for the last, say 3 weeks. Now CSR pattern shows a typical ink blot pattern of leakage. As the time passes, the leakage, it spreads in all directions. This is right eye of the patient, it's normal. Case 2 is a 38-year-old female presented with CSR. CSR pattern is that of typical smokestack leak. The dye is ascending from the point of leak and making almost a mushroom shape. The left eye of the patient is again normal. 33-year-old female presented with diminution of vision in the left eye for the last few days. FFA was done. Now CSR pattern of the patient, again it is of typical smokestack, though at the root from where the first leak appeared, there is a small RPD also. This is right eye of the patient. It also shows a small RPD. 33-year-old female presented with diminution of vision in right eye for the last 5 days. FFA was done. In the initial film, there were 2 leak points. One point, it got converted into ink blot, dye spread in all directions. The other one went into a smokestack pattern. So it is a combination of 2 leaks of different patterns. This is left eye of the patient. It shows a small RPD. Now case 5 is 48-year-old male. He presented with decreased vision right eye, diagnosed as CSR on clinical examination. Patient showed a ink blot type of leak. If you notice finely, there is a small RP defect adjoining the ink blot leak. This is case 6. 2 leaks appeared in the beginning. As the time passed, both the leaks, they got converted into a smokestack appearance. 41-year-old female presented with diminution of vision in right eye. There were 2 leaks. They were quite near. Both of them got converted into smokestack, and they ultimately merged into a 1 leak at the end. This is 42-year-old male presented with diminution of vision in both eyes. Patient was having some skin problem for which he was given some treatment. It was probably steroids, oral steroids for skin problem. So this is right eye of the patient. There are 2 leaks and ARPD in this eye. The other eye of the patient is also showing CSR with a leakage. So bilateral CSR are usually common in patient on steroids. This is case 9. It showed multiple leaks. There were 3 leak points. If you notice in the first film of the FFA, there are 3 leaks. The upper one seems to getting converted into ink blot, smokestack, and the lowest one into ink blot. Central one I am still not able to decide whether it is getting converted into a smokestack or it is a ink blot leak. Now this is 42-year male patient. He presented with defective vision in left eye somewhere in 2013. He was diagnosed as CSR. He showed RPDs and a leak. Focal laser was done. And after 2 years, the patient came and tells me that the problem has recurred in the eye. When the record was seen and again FA was done, it was actually the other eye. Now this time it was the right eye with 2 leaks, ink blot leaks, which merged into 1 later on. So this is the other eye of the patient, left eye, which was lasered in 2013, and there are few laser ones near the fovea. Thank you very much for your kind attention, please.